Oral questions by members.
Member for North Island.
Last night it was reported that 1 of 4 OBGYNs resigned from Ridge Meadows Hospital. This happened in the Minister of Education's riding on the heel of the mass resignation of 7 Kamloops OBGYN and an open letter from 130 obstetricians and gynecologists condemning this province for using temporary physicians. Dr. Charlene Louis, President of Doctors of BC, warns that the province doesn't have a plan and that using temporary physicians will only continue, quote, to destabilize the system. Can the minister please tell us how many other hospitals across BC are at risk of OBGYN shortages or mass resignations?
Minister of Health.
Thank you, Honourable Speaker. Thank you to the member for the question. First of all, I just want to address the issues in Ridge Meadows and say that it is stressful. It creates anxiety for expectant mothers and for families who are anticipating the birth of their child. And to know at this time that there's a possibility of interruption of services is a tough thing to take. And I do want to thank the team at Maple Ridge and Ridge Meadows for the service that they're providing to people. Mr. Speaker, the member talks about the short-term actions that we have to take and that health authorities continue to focus on to provide what we all have as a common goal, which is stable maternity services for women and families across British Columbia. Mr. Speaker, those short-term actions are essential to make sure that the care is there and it can be delivered. But, Mr. Speaker, it also speaks to why we have to continue the work that we're doing in the creation of a new medical school here in British Columbia to train the next generation of doctors, to reach out to jurisdictions like California, Washington, and Oregon to invite physicians to move here to British Columbia to practice in our universal public health care system. Mr. Speaker, that is the long-term work that has to happen to provide those stable services. It is work that our government is entirely focused on, and we are not going to stop until we are able to see those stable services in place. We are going to continue to work with physicians, hear them, listen to the doctors of BC, and create the situation where the provision of care is there for people when they need it and where they need it, Mr. Speaker.
Member supplemental.
I've been a practicing physician for almost 40 years, and I've done deliveries without OBGYN backup, and I'll tell you, it can be pretty scary. The resignation of OBGYN is having a domino effect. I've never seen, in all my career, almost 40 years, the system being so fragile. Departments are running at full capacity with one body away from closing. We warned this wave was coming, and it's here. The minister did not answer my question, and women across BC want to know, how many hospitals across BC are at risk of OBGYN shortage or mass resignation? Give us a number.
Minister.
Thank you, Honourable Speaker. The member refers to what is happening in Kamloops, where 7 OBGYNs have tendered their resignation letter, but continue to sit at the table with Interior Health as Interior Health listens to their concerns and does the work with them to hear those, to create what we all need and expect, and that is stable maternity services, not just in Kamloops, but across the province. The situation in Ridge Meadows is different, with 1 OBGYN leaving and others making their decisions, but it is not a mass resignation, Mr. Speaker, and I want to be really clear about that. But the member speaks to the need to continue to double down on the work that has to be done, training new family physicians, some of whom will choose maternity specialties, who support women with low-risk pregnancies. Mr. Speaker, the work to attract and train new specialists, new OBGYN, who will move to British Columbia, who will train in British Columbia to practice these services here. Mr. Speaker, that work is absolutely essential, and yet members of the opposition opposed our idea to recruit into the U.S. and to ask American physicians to move to British Columbia to practice, and that is happening. American physicians are moving here. They are.
Members, wait for your turn. Members. Members.
We
Minister.
are.
Members.
We are
Minister.
going to continue the work of training, of recruiting, of hiring, of streamlining credentialing for those physicians who are coming here from other jurisdictions. Mr. Speaker, continuing to work with physicians, hear their concerns, take the short-term and long-term actions that are necessary to build out a stable system of care for British Columbians who expect it, who deserve it.
Member for Courtney-Comox.
The only thing this government is continuing is managing the decline of our fragile healthcare system, Mr. Speaker. This government certainly supports your efforts to recruit from the United States, but we'd like you to put some focus on retention as well.
Through the chair, member.
Mr. Speaker, there are 24 hours left, and as recently as yesterday, the minister has repeatedly acknowledged this government does not fully understand the impact to the cuts to long-term care and assisted living across this province. Will the minister commit today, again, to stop these cuts and put seniors first? Yes or no?
Minister.
Thank you, Mr. Speaker, and thank you for the opportunity once again to talk about how important it is to provide safe and secure care for seniors in this province. Why this government has invested millions and millions of dollars into building and renewing long-term care homes in this province. Mr. Speaker, we canvassed this heavily yesterday, and I know that the members of this House understand that the winding down of a temporary stabilization program that was brought in is a measure that we have taken while we work with operators to understand the particular challenges that they're facing, Mr. Speaker. But in the meantime, we are making up for years of neglect into long-term care. Mr. Speaker, so, for example,
members, come to order, please.
in the member, for
Members.
example, Mr. Speaker, in the constituency of Courtney-Comox in the member's own riding, 156 new beds that were completed and opened in July 2024. Mr. Speaker, just a couple of years before that, 104 beds completed in 2022 in the member's own riding. These are the beds. These are the beds that are needed to provide that safe, secure care for the people that we love. This is work that this government is deeply committed to. We have a proven track record of investments and new beds, safe, secure care for the people that we love.
Member has supplemental.
Thank you, Speaker. The minister mentions new beds in my riding. 100 of those beds are at risk of closure through these cuts. If this minister is reaching into the Wayback Machine, Mr. Speaker, she should look at the person sitting in front of her. Yesterday, Mr. Speaker, the minister brushed this off, saying it's only 6% of long-term care beds. Well, that 6% is 850 grandparents who could be pushed into hallway cares or onto the streets. This may be the largest cut to seniors' care in British Columbia's history. We're down to 24 hours. Will this minister stop these cuts today, or will MLAs be fielding calls tomorrow from concerned families asking where their loved ones are supposed to go?
Minister of Health. Member for South. Minister of Health.
Thank you, Honourable Speaker. We continue to meet with operators to discuss their particular situations, Mr. Speaker, and we understand that transitions are a difficult time. That's why it's so important to hear from them. Mr. Speaker, that is why we met yesterday with the BC Care Providers Association to hear directly from them about their insights and the information that they have to share with me and with the ministry. Health authorities continue to work with operators. There is not one person is going to be kicked out of their bed, of their home tomorrow. And for anyone on the opposite side to infer that is absolutely wrong. Mr. Speaker, we're going to continue the work to address the root causes of what these facilities are facing in terms of being able to recruit and retain healthcare assistants, Mr. Speaker, licensed practical nurses, registered nurses, Mr. Speaker, all of the dedicated people that make these facilities what they are and who care for our grandparents, for our parents. Mr. Speaker, this is the work that we have to continue to do. We are deeply committed to working with every single operator, every single facility that comes forward. That work will not stop.
Leader of the third party.
Thank you, Honourable Speaker. The Premier has said that local news outlets are, quote, treasures to local communities, end quote. And in the spring in this House, the member for Nanaimo-Lantzville lamented their slow deterioration. Mr. Speaker, I concur. Locally based media and local news are essential to community cohesion and a healthy democracy. In this time of instability, trustworthy journalism is more important than ever. This week in our caucus, we've been talking about integrity. But in this government's urgent pleas to buy BC, they may have forgotten to look at their own spending. It's estimated that the province spends the vast majority of its advertising budget with American tech giants like Meta and Google. Meanwhile, in Ontario, the province mandated that its Crown agencies allocate at least 25% of their advertising dollars to local news outlets. Mr. Speaker, if we can copy Ontario's anti-tariff ad campaign, surely we can follow their lead on this. My question is for the Premier. Will his government commit today to spending at least half of its advertising budget with BC-based news media?
Mr. Premier.
Thank you, Honourable Speaker, and thank you to the member for the question. Following the actions of the U.S. President, we issued a number of directions to Crown corporations and to government as a whole, including to remove U.S. liquor from the shelves, to prioritize contracting and purchasing from trade allies and from Canadian companies and BC companies first, and to make sure that that applied across the board, including to advertising. We have worked closely with the advertising sector related to local media. They've been reaching out to us to say the government advertising should be focused on local media, and we are ensuring that we are meeting those obligations. I'm happy to brief the member on the numbers so that he has the information that we have about how we spend to support local media. And we're getting the message out to British Columbians about flu vaccines, about wildfires, and other crucial information that they need to have.
Member supplemental.
Thank you, Honourable Speaker. I thank the Premier for his answer. When a road is washed out by an atmospheric river or wildfire forces communities to evacuate, people of BC deserve a reliable source of local, trustworthy information. In the modern age, people turn to a variety of sources. Government should advertise in all of them. By advertising almost exclusively in foreign-owned social media, a significant portion of our population isn't receiving the message. This isn't about propping up a failing industry or spending new money. This is about shopping local and supporting integral institutions instead of parasitic corporations. The Premier's NDP counterpart in Manitoba convened an all-party committee to explore the future of journalism. Will the Premier do the same?
Premier.
This is the first I've heard of the initiative of the remarkable and talented Premier of Manitoba. I'm happy to engage with them and the member on these discussions. I think it is crucial that media is supported across Canada as a verifiable source of information for Canadians, and happy to engage in those conversations.
House Leader of the fourth party.
Thank you, Mr. Speaker. Without logs, forestry dies, like a restaurant with no food. And forestry was the backbone of our province for decades, providing jobs, infrastructure, revenue, and helping build small towns across BC. Today, the industry is in ruins. The cause? A steady decline in the allowable cut. Powerful US-funded environmentalists have weaponized our love of nature, using endangered species laws, so-called old-growth protection, and climate scams like carbon credits to lock up productive forest land. Simultaneously, Indigenous tribal chiefs and reconciliation industry lawyers leverage spurious sovereignty claims to engage in lawsuits or blockades which restrict access to public forests, as we saw with Fairy Creek. My question to the Minister of Forests is this: will you take even one small step to reduce the control that the environmental and reconciliation lobbies have over your ministry?
Minister of Forests.
Thanks very much, Mr. Speaker. I'm very proud to be the Minister of Forests and to be able to work with the entire forest sector, which includes environmental organizations, First Nations, to really look at the path forward. We are facing dire circumstances in forestry right now because of the challenging circumstances we're facing with Donald Trump's attack on our forest sector. And this requires us to be able to look at the future of forestry. I want to acknowledge the member's comments about forestry being the bedrock industry for the province of British Columbia. I feel very strongly, as does the Premier and those members on this side of the House, that forestry will continue to be that strong, sustainable sector that produces and creates good-paying jobs in every corner of this province. And unlike the member opposite, we are not going to pit First Nations against government. Unlike the member opposite, we are not going to cut down more old-growth trees and go back to 1950s-style clear-cutting efforts. What we are going to do is lay the path forward that ensures that we can have a strong, sustainable sector that ensures that we're stewarding our lands, protecting our communities from wildfires, and ensuring that we are creating prosperity in every corner of this province.
Member has supplemental.
You know, it's a funny thing. Donald Trump can't destroy our forest industry because the Premier already has. In fact, he's beaten it to death. This government has destroyed this once mighty industry. It's so bad that paper mills in Port Alberni are importing fiber from, you guessed it, the United States. In the name of reconciliation, this government is refusing to issue cutting permits necessary to keep mills open. While BC's allowable cuts decline, our neighbours over in Alberta have increased theirs by close to 50% over the past couple of decades. My question, will the minister commit to increasing the allowable cut?
Minister.
Mr. Speaker, Forestry 101, I think, is an important thing for all members of the House. The government does not increase the annual allowable cut. The independent chief forester sets the annual allowable cut. What I will do, Mr. Speaker, is work across government with all of my colleagues, Minister of Waterland and Resource Stewardship, the Minister of Environment, to ensure that we can move forward on a major project that the Premier has set. And that is to ensure that we can have a strong, sustainable forest sector that produces a harvest that creates jobs and prosperity in every corner of this province. We are doing that on the coast, where we have seen a significant reduction of raw logs leaving our communities and jobs leaving our community. As an example, when we took government, over 6 million logs were leaving, cubic meters worth of logs were leaving our province every single year. That's enough logs to build over 100,000 homes. Those numbers have gone down considerably since we took office. Another example in the interior, we are investing in value-added manufacturing. In my colleague from Castlegar's riding, we have a first-of-its-kind mass timber modular housing facility, the first of its kind in North America, here in British Columbia. Mr. Speaker, these are the steps that we're taking to ensure that we can have a strong, sustainable forest sector, and we won't apologize for the work that we're doing, and we'll bring First Nations, we'll bring industry, all to the same table to build that path forward.
Member for Skeena.
This Premier has so little faith in his ministers' ability to do their jobs that he has hired Michael Bryant, Penny Ballum, Doug White, Larry Campbell, Nathan Allen, George Heyman, Daniel Vigo, and Charlie Demers. Over $2 million in consultants in 1 year. I wonder if that's why this government is cutting long-term care funding. During a public sector hiring freeze, how many more NDP friends and insiders will get six-figure contracts to try to shield this government from its own failures?
Minister of Finance.
Thank you, Honourable Speaker. Thank you to the member opposite for the question. When we hire external people to come in and assist us, it's because they have a unique skill set. that positions them to do really important work. And I'll share with the member opposite a perfect example of that which she mentioned, which is George Heyman, someone who has been the head of the BCGEU and a member of government who provided very sage advice to me. This is a very unique skill set, and having people who have such important skill sets assist us is money well spent.
Member for Skinner supplemental.
Thank you, Mr. Speaker. I still think that the primary job of this government should be trying to make sure that we can keep long-term care beds open, but this Premier claimed he could fix the problems on the downtown east side when he became Premier. It's been 3 years with absolutely no progress. Now he's hired another communications staffer, Nathan Allen, at $140,000 to do public relations for him on the downtown east side. The Premier himself, the ministers and the parliamentary secretaries he appointed clearly couldn't get the job done. So again, to the Premier, can he tell us how many NDP insiders it takes to fix the problems he created?
Minister of Housing and Municipal Affairs.
Thank you, Mr. Speaker, and thank you to the member opposite for the question. Mr. Allen is returning to a position that he held a year ago. It's a public engagement role that will focus on housing and bringing community voices together in the downtown east side. This government's work in the downtown east side is significant. Since 2023, we've opened 800 new and renovated spaces, more than 900 more on the way. We continue to focus on results for people. That's our work in the downtown east side, seeing tangible results for the community there and far beyond. We're doing that work in ridings in communities all across this province, including many of the communities of members opposite, working with local leaders, working with community leaders to open winter shelters, to open supportive housing. We are focused on people, and we will continue to do that work.
Member for Fraser-Nicola.
Thank you, Mr. Speaker. Earlier this year, the government downloaded Ecom 911 cost onto 9 Vancouver Island ridings. 9 mayors called the downloading hugely unfair, untenable, and poorly handled. Why is this government hell-bent on making municipalities pay for their mistakes?
Minister of Public Safety and Solicitor General.
Thank you very much to the Speaker, and thank you to the member opposite for the question. We have heard from municipalities about some of the challenges related to the increasing costs of emergency call services. We are about to release a report that will
Why don't you get up and ask a question?
Members.
We will
Please
soon be
continue.
releasing reports that the Premier, that are
Members.
the aftermath of the Premier's decision to call for a review of the Ecom service, which provides invaluable emergency call services for municipalities across the province. We are committed to ensuring that we're working with municipalities so that they can continue to deliver the core service that when people call 911, they receive the prompt service that they need. We'll continue to do that work with municipalities, and we'll look forward to the continued conversation.
Member for Fraser-Nicola supplemental.
Thank you, Honourable Speaker. Healthcare is crumbling and cities are being forced to step up. Surrey is the latest city working to open their own primary care clinic to make up for the government's healthcare incompetence. Surrey has half the family doctors of Vancouver and now is taking on the task of providing health care because this government will not. Will this government fund the Surrey clinic, or will that leave City of Surrey holding the bag yet again? Yes or no?
Minister of Health.
Thank you so much, Honourable Speaker. It's a real pleasure to have the Mayor of Surrey here in the House today, and I want to compliment her and her council and the city for the work that they are doing. Mr. Speaker, that is true partnership, understanding that health care and ensuring that your citizens can access it is fundamental to the economy of your city. Mr. Speaker, that it is fundamental to being able to attract new businesses, new investment, to invite newcomers to come and live in your community and see it thrive. So kudos to the City of Surrey, Mr. Speaker. It is an example of the way that our government is working with municipalities, local governments around the province, whether it's Sicamous or it's Creston, it's Caribou. These are communities that are stepping up to the table and they are participating in recruiting physicians and healthcare workers to their communities because, Mr. Speaker, they know their communities best. And that is why taking a Team BC approach to building out infrastructure, to attracting the healthcare workers who are going to be members of their communities is a fantastic idea, and I thank every single local government that is stepping up to do that work.
Member for Kamloops Centre.
Thank you. That answer very clearly shows why cities are pleading with this government to stop the downloading, because they're counting on municipalities to continue to add provincial responsibilities under local taxpayers. We have the small businesses across this province begging for tax relief, especially property tax relief. We have sawmills and pulp mills around this province pleading for help from this government that has created the highest cost forestry jurisdiction in North America with their NDP policies. We have a premier that says he's opposed to a northern pipeline because we need to maximize the value of the existing pipeline networks that we have in British Columbia. Correct. Yet later this month, the Minister of Finance is being asked to sign off on a 30% reduction of the assessed values of those existing pipelines in British Columbia. Now, pipelines are capped on the property tax rates they can pay, which means that's a 30% tax holiday for those same pipeline companies the Premier says we have to maximize the value of. And who will have to pick up that cost, Mr. Speaker? The pulp mills, the sawmills, and the small businesses that this Premier says they are standing up and fighting for. So the government has two simple solutions. They can either say they will reject the reduction, the 30% tax holiday for pipelines being suggested by BC Assessment, or they can increase the cap on the mill rates for Class 2. Which is this government prepared to do today?
Minister of Finance.
Thank you, Honourable Speaker. Thank you to the member opposite for the question. First, I want to say that BC Assessment has been doing this evaluation of models work over a 10-year period. It's not yet come to my desk. I expect it to come to my desk in November. But I'll share with the member that I too feel concerned. I feel concerned any time that there is a downloading of taxes onto small businesses and onto people, and I look forward to reviewing this report.
Member supplemental.
Thank you. Well, it's a pretty easy concept, and surely the minister must have been aware of it because it has to be approved by the end of November, according to BC Assessment's own presentations to local governments. So it's shocking that the government doesn't already have a position whether or not they were going to take action or not. But it's interesting because it's always tough to understand what exactly this government and this finance minister is doing. On the first quarter update, Mr. Speaker, when concerns were raised about the sleight of hand happening with the tobacco settlement money in British Columbia, the minister assured everybody that it was standard accounting practices, and in fact, the Auditor General would be quite happy with how BC was handling that sleight of hand with booking 18 years worth of a settlement in 1 year to try to deflect and make their horrible, horrible record deficit look a little bit better than it actually is in real life. Well, Mr. Speaker, just the other day, the Auditor General actually indicated that no, in fact, they're not overly impressed with how this government chose to do the bookkeeping on the tobacco settlement. So can the minister please explain the disconnect between the words she keeps trying to convey to the public about the budget bookkeeping they continue to do to try to hide their record deficits over the language we're hearing coming out of the Auditor General's office?
Mr. Premier.
Thank you, Honourable Speaker. Let me be a member in this House who rises to thank the Attorney General and her team for closing off litigation that was started by an NDP government almost 20 years ago against the big tobacco companies who lied about how tobacco was addictive, didn't cause cancer, on, to hold them accountable for the harm that they caused in our province, to deliver literally billions of dollars to the province of British Columbia to help pay for the harm that they caused. Way to go. Way to go. Let me thank her and her team for holding opioid producers to account for the largest healthcare settlement in British Columbia history, bringing billions of dollars to provinces and territories across Canada, grappling with the opioid crisis that they caused. Congratulations, Attorney General. Let me thank the Attorney General and her team for bringing forward legislation to hold the vaping companies to account for the vaping epidemic among our young people and the harm they are causing to youth across North America, so that they finally pay for the harm that they caused, Honourable Speaker. Congratulations to the member. I love having a problem. I love having a problem.
Members will come to order. Hold it. Member for Abbotsford South. Members, Premier has the floor. He will answer. Shh. Premier.
Sorry, kids. I love having a problem of how to account for billions of dollars recovered from wrongdoers who hurt people in our province. We're going to keep doing it. And if it's a problem of how to count the money, then bring it on.
The bell ends the question period.